welcome back to the YouTube channel. And I'm Lolo.
And I'm Yassy.
And together we are Yassy&Lorlor. Okay, achish. The itchiness is too much. Oh, my abdomen aches. Ouch, ouch, ouch. Of course, today is about UTI, urinary tract infections. Women have been going through urinary tract infections. Men too have been going through urinary tract infections. Today we are going to tackle every area of it, from symptoms, causes, risk factors, what to do when you have it, prevention and complications. As we know, prevention is better than cure. So don't wait to have urinary tract infection before you cure yourself. Prevent it. Urinary tract infections are infections that affect our urinary tract system. When it comes to the urinary system, we have the kidneys, we have the ureters, we have the bladder, and we have the urethra. From the top to the down. But the most place that gets infected is our bladder and our ureters, because they are lower. They are closer to the anus. Anus is where the germs comes from and all that. For the germs to get to your kidneys and your ureters is very serious. So don't allow infections get to your kidneys. So now we start from the symptoms.
The first symptom is that you have persistent urge to urinate. The next minute you go to the washroom, the next moment you want to visit again, and it comes in little quantity. Another point is that there's a strong smell when you pass urine, so it doesn't smell like the normal way. It's very foul, it's very bad. There's also burning sensation in the urinary tract when you are eating or urinating yourself because of the infection. So the nature of the infection, that means that it has gotten to that point where it is kind of serious. So you have to visit your doctor. Another point is that the urine looks cloudy. It looks pink. It looks like Coca-Cola. It's not like the normal color of the urine we all know. So that's also another sign that there's a problem, so you have to go and check. The last symptom is that women experience pelvic pain in the center of their pelvis. So there's a little bit pain down there.
Yeah, and around their pelvic bone.
Yeah. So these symptoms should alert you that you should visit your health facility ASAP.
So we have types of urinary tract infections. Like I mentioned earlier on, we have when it comes to the urinary system, we have the kidney, we have the ureters, we have the bladder, and we have the urethra. So in every organ, every part of the urinary system, the infection can occur there. So we pick the kidneys. But the kidneys is very dangerous when it gets infected. So we should be very careful. And so the doctors will term the bacteria that has affected the kidney as what's the name, pyelonephritis. It can be acute, it can be chronic. So the infection that goes on in the kidneys is pyelonephritis, acute or chronic. And when it comes to the bladder, we have cystitis, that's inflammation of the bladder. So those are the types. And when it comes to the urethra, we have urethritis. When all these organs are infected, there are all types of urinary tract infections. We try our possible best not to infect these parts of our urinary system, because it can cause a whole lot of damage when it comes to our urinary system. And our urinary system is very important, because it's a drainage system for the waste products in our body. So let's try our possible best to not get infected. So these are the types of urinary tract infections. Okay, now so we take on from the risk factors.
Okay, so the risk factors are what
makes you prone to urinary tract infections, the possibility of getting urinary tract infections. Yeah,
thank you. So one risk factor is the female anatomy. When we say the female anatomy, it has to do with the nature of a woman's vagina and where the urethra, which can be infected, is positioned. So the urethra is positioned in the vulva of a woman, but for the men, the urethra is positioned independent of the man. So with that, a woman can easily get infected when she doesn't take care of herself after the washroom. But the man is safe because his urethra is far from the anus.
So the urethra is short, so it makes the woman prone to getting urinary tract infections. Yeah.
The next one is there are certain types of birth controls that women take that causes urinary tract infections.
Like spermicidal contraceptives and diaphragm contraceptives. You should be very careful when taking them. And you could try other kind of contraceptives like normal family planning. You go to a hospital facility to help you understand how to go about how to take care of yourself to prevent multiple pregnancies and how to distance your birth giving birth. Yeah, so those kind of contraceptives help makes you prone to getting urinary tract infections.
Another point is sexual activity. So when a woman is sexually active, I mean highly sexually active, and and she's not able to control herself, and in addition, she also has multiple sexual partners. Risk of getting UTI is also high.
Very high. Yeah.
So please, as a lady, try to reduce the urge of sex in order not to attract the infection.
Yeah. And even if you have a single partner, you should make sure your partner is very clean and safe. Both parties have to be clean and safe to prevent infections, because at the long run you can get infected in so many ways. Yeah.
And the last point is menopause. So when a woman reaches the menopausal stage, the estrogens are reduced, so she's at a high risk of getting the urinary tract infection. Yeah.
So all these are risk factors of getting urinary tract infection, so we should look out for them. Being sexually active on your menopausal stage, what else, using some kind of contraceptives, all these things it makes you prone, so you should be very careful. Yeah, so now we're going to take the complications of urinary tract infections. Prevention is better than cure, but when you have it, you should try your possible best to cure yourself, treat yourself, because when it gets to the kidneys, it's very dangerous. Very. We have permanent kidney damage. Your kidneys can be damaged, and you know why our kidneys are very, very important to us. So we should try and keep ourselves very healthy. So some of the complications that we can have is recurrence of infections. When you don't treat them and it keeps long, like 6 months, 3 months, 6 months, your infections becomes very recurrent and it travels into the bloodstream, causing so many damages there. You try our possible best to treat those infections when we get them. Another complication is we can have sepsis, infection in the body, infection inside the whole bloodstream. Is very dangerous, very serious. So we should treat the infections when we realize all the symptoms that we mentioned about. When you realize all those symptoms, should mention them before it gets to those complications. And our next point is you can have a situation whereby a woman in labor, in a point of delivery, you can have a premature baby or low birth weight of your baby. So we should try our possible best not to get complication like this. And another point is the narrowing of the urethra of the men. When you get urinary tract infections and it gets complicated, they can have strictures of the urethra, especially with the men. It will be narrowed, and when you are excreting your urine, it becomes very painful because the tube is very narrow. So you try possible best to avoid all these. And you can, as like I said, we can have kidney damage as well.
Alright, so for the preventions, the first thing is that you have to take a lot of water or a lot of liquids, but most importantly water, so that if there happens to be the bacteria in there, the more water you take, the more you need. It flushes out all the bacteria out, okay, so that you be less likely to get infected. The other point is Amen. Okay. So the next one is that you have to wipe from front to back. Okay. Normally we forget ourselves and then we do it anyhow. So after you've done your thing, after you've done your thing in the washroom, ensure that you clean from the front to the back, especially the ladies. One is that you have to empty your bladder after intercourse, whether you have the infection or not. Empty your bladder. So after your good time with your partner, ensure that you ease yourself, whether you feel like it's plenty or it's not. Please ease yourself. It also helps wash or flush out the bacteria.
Yeah.
Another one is that you have to stop using potential feminine products which are irritating, meaning they cause the plates to
Like we the ladies when we are going out and everywhere like that. What's that?
Some of our ladies use some perfumes.
Yeah,
Some perfumes that they want to make the place smell nice. At the end of the day, you are causing harm to yourself. You are attracting infections and bacteria to yourself. So please, let's stop that. And there are some feminine products that we insert there that are not safe. So when you notice these things, you put a stop to them. The last prevention is to watch your birth control methods. If you realize that the birth control methods are giving you some of the symptoms, the bad symptoms we mentioned earlier, please put a stop to the birth control. Visit a health facility, speak to a doctor for maybe a better solution or new birth control method for you to feel comfortable down there. Because when the down there is not comfortable, trust me, it's not good.
Yeah. Okay. So lastly, what I can add to what we've learned today is that our undies, what we wear under there, should be cotton wear. Cottons are very good absorbents of sweat. So we try our possible best to wear them cotton wears and avoid all the nylons and the net panties, to keep ourselves clean.
The G-strings. The G-strings too. Sometimes, it's nice to wear, but sometimes, because like we said, from the vagina to the anus, it makes you prone to.
It's very when you're wearing a G-string, it's very easy for the bacteria to travel from your anus to down there, So let's try and prevent it, okay?
And dry our panties in the sun, to kill the bacteria.
Right. We change our undies all the time. No way one underwear for 3 days. And the men as well.
The boxes. They look brown and dirty.
So let's be changing them, okay? To have a better smell of down there. Okay. So thanks for listening today. I learned something, and I know Yasmin learned something.
I did
as well.
plenty.
Thanks for subscribing. Thanks for sharing. If you are new here, thanks for watching us, and there's more to come. So stay tuned. Please like, subscribe, share. Let's have fun. Let's learn something more, and let's keep ourselves healthy. So to meet again.